for joining on the third day on the for the Oral Awareness Month, which where ICanCaRe along with the Foundation for Head and Neck Oncology, Sterling Cancer Hospital, and Gujarat University, conducting this ICanCaRe second International Oral Cancer e-Conclave. So a very warm welcome to everyone to this third day of scientific session.
And I'm sure now people have been waiting for the quiz, and that's the highlight for today. Also, again, the quiz is there, and we look forward for everyone to join in. And I would request our quiz leader for today, Dr. Dushyant Mandlik, to take over and please.
There are interesting prizes. There is a certificate from the organizing committee, and there are scholarships also for this tuberculosis and specialist courses. The first person has 50%, second person has 40%, third has 30%, and fourth has 20% rates to the scholarship. And definitely there are special gift hampers and gift coupons also. Can we go to the next slide, please?
And that's the Certified Tobacco Cessation course, which has been introduced by ICanCaRe in collaboration, in accreditation with Gujarat University, which Rishabh had already told about. So, of course, we have Dr. Dushyant Mandlik and Dr. Rashmi Shukla as the leaders. So, these are some of the experiences which I think Dr. Dushyant, please.
Yeah. So this quiz is conducted for the third day right now, and to win you have to participate in all the 3 days in all the quiz. And the quizzes will be having 20 questions. Today's quiz will be on the theme of today. Today's quiz is prepared by Dr. Harsh, and points obtained for all the 3 days will be added to select the winners. In case the tie, the fastest time of submission of the total of the 3 days would be considered, and then winner would be the highest and fastest total of the 3 quiz. You can also see the results on the given links, and all winners will get certificates and scholarships for CTCS, and the top 3 gets the gift hampers. The winner can avail the scholarship in the next scheduled online CTCS course, and the decision by the organizers will be final and abiding, and all participants for the quiz will get the discount coupon. So today our quiz master is Dr. Harsh Dhar, who is consultant head and neck skull-base surgeon. Today together, we were all there together, me and Harsh, at the airport right now, Harsh?
Yes, sir. Yes, sir.
Yeah. So he is MSMCH head and neck oncosurgery as TMS Bombay, and leading consultant head and neck surgeon as SSK AMIPG NER Hospital, Kolkata, and he has special interest in thyroid and skull-base surgery, but he is an accomplished young head and neck surgeon, and I will hand over the quiz to him now.
Right, so thank you so much, sir. Thank you for the organizers to give me this opportunity. So right at the outset, I'll just read out the instructions for candidates. You will get a link that is to be shared in the chat box. Participant need to open the given link. Please fill in your email, your name first, so that your response can be properly recorded along with the name. Start answering the questions, and after we share in the chat box, I think all the link on the chat box will be further disabled. So once you start answering the questions, you will have a total time of the 10 minutes to answer all the 20 questions. So we will keep reading out the questions to you on the screen as they come, and at the end of the 10 minutes, you have to submit, because you will not be able to submit it once the 10 minutes are over. Right? So please enter all the relevant details so that we can identify you correctly. Right, so everyone, welcome to the quiz time. All the best to everyone. No Googling, please. Right, so question number 1. Which of the following are true about the melolabial flap? Option A, very good option for alar defects. B, can only be superiorly based. C, can only be inferiorly based. D, have the best for match for skin at the dorsum of the nose. And E, cannot be used as advancement flaps. Please remember, you have to say which of the following is true. Right, so we go to question number 2. It's a slightly long question. Which statement best describes reconstructive and rehabilitative goals in PNS cancers? A, all the functional rehabilitation is important following surgical removal of PNS tumors. Aesthetic results take precedence. B. It is essential to obliterate the maxillary sinus space following a total maxillectomy for optimal functional cosmetic outcome. C. Often a stage-free tissue transfer procedure to separate intrathecal cavity from aerodisal tract is preferred to primary closure with local flaps to allow recognition of postoperative complications first 24 hours. Or D. Rehabilitative after resection of venous tumors may be achieved with a dental prosthesis or reconstructive flaps, western pelvis flap, with or without the inclusion of tail bone, pedicled or microvascular cutaneous flaps and cutaneous flaps. It's a long question, so can I request them to give another additional 15 seconds maybe for this question?
Yes,
Can,
sure.
Yeah,
Sure,
yeah,
Dr. Ash. We should give some few more.
yeah. Please read through carefully. Each and every word is important in this question. One single word in the question can change the whole thing. Right, sir. Question number 3. Which will be the correct order of flaps as per the reconstruction ladder in order of increasing complexity? Regional flap, microvascular flap, primary closure, secondary intention. Secondary intention followed by primary closure, followed by regional flap, followed by microvascular flap. Regional flap followed by secondary intention, followed by primary closure, followed by microvascular flap. Or option D, primary closure followed by microvascular flap, followed by regional flap and secondary intention. So the question is as per order of increasing complexity. This is the reconstructive ladder, components of the reconstructive ladder, which you should all know about, which is the basic thing we learn in when we start reading about plastic reconstruction. Right, question number 4. Which one is not a transposition flap? Rhombic flap, bilobed flap, C. Node flap, D is dorsal nasal flap, or E. Z-plasty. I repeat, which is not a transposition flap? Rhombic, bilobed, node flap. Yeah. Question number 5. Question number 5. The blood supply to parascapular flap is A. Dorsal scapular artery, B. Shared between parascapular flap and lateral foci flap. This is not distinct from serratus anterior flap. B. Runs between teres major and minor muscles. E. From the angular branch of thoracodorsal artery. Slightly difficult question because it's not a very commonly used flap. That is the gold medal question here. Question number 6. All the following are true regarding cephalocerebral flap for manual defect except A. A length of up to 20 to 25 cm can be harvested. B. Multiple osteotomies can be performed to control the bone segment according to the mandibular defect. C. There is minimal morbidity in terms of weight bearing and movement after harvesting of fibular graft. D. Adequate amount of soft tissue is available along with the skin paddle for reconstructing soft tissue defects. Question 7. Which vein is not a reliable recipient for a free flap? External jugular vein, internal jugular vein, C. Facial vein, D. Anterior jugular vein, E. Middle thyroid vein. I repeat, which vein is not a reliable recipient for a free flap? Question number 8. Which is true regarding the deltopectoral flap? The donor side can be closed primarily. Preferred choice for pharyngeal reconstruction. Blood supply is from maxillary artery. D. Should be raised as a musculocutaneous flap to preserve blood supply. D. Distal end of the flap has the most robust blood supply. Question number 9. Which is true regarding a palatal island flap? Pedicle is from facial artery, option A. Option B. Blood supply from both sides must be preserved. C. Blood supply is from greater palatine artery. D. Blood supply is from the lesser palatine artery. E. Donor site has to be closed primarily. Question number 10. Which vessel is the most common choice for microvascular anastomosis in the neck? Superior thyroid artery, B. Facial artery, C. Lingual artery, D. Transverse cervical artery, E. Occipital artery. The question is most common choice. Question 11, and we are at the halfway mark. Which of the following are true about advancement flaps? Works better in areas in skin with less elasticity. have the greatest tension perpendicular to the proximal border of the flap, that is the base. Not a good option for cheek defects, works well in dorsal nasal defects, are very good option for forehead defects. Question 12, you have to look at this picture and you have to give us what will be the classification of this bony defect. The dark area is the bony defect as per the James Brown classification of mandibular defects. This was published recently in Lancet 2 years back. So 1, type 3, type 4B or 4C. Question 13. Which flap is most ideal for reconstruction of large full thickness scalp defects? Anterolateral thigh flap, latissimus dorsi flap with skin graft, lower trapezius island flap, vertical rectus abdominis musculocutaneous flap, and E parascapular flap. Which flap is most ideal for reconstruction of large full thickness scalp defects? A small hint, you have to think about the reach of the flap. Question 14. Blood supply to the temporoparietal facial flap. Internal maxillary artery, B deep temporal artery, C supraorbital artery, D superficial temporal artery, E posterior auricular artery. The question is temporoparietal facial flap. Question 15. All the following are true regarding pectoralis major myopinous flap except it is based on a branch of the thoracoacromial artery. B. Transposition of the flap is limited by the arc of rotation of the pedicle over the clavicle. C. It can be used to reconstruct scalp defects. D. The most distal aspect of the skin pattern is the most poorly perfused. And E. Gravity may cause superior dehiscence of flap. Question 16. The following are prerequisites for rehabilitation using an obturator after maxillary defects except defect should ideally not be more than category 2B as per modified James Brown classification. B. There should be a posterior shelf of soft palate so as to minimize nasal regurgitation. C. The patient should have adequate mouth opening to enable measurement of defect and placement of prosthesis. D. The opposite upper alveolus should be edentulous. So which are prerequisites except? Question 17. A full thickness defect of the upper lip not involving the philtrum and measuring less than 1/4 of the lip width should be closed. A. With a perialar crescentric flap. B. With perialar crescentric flaps combined with an Abbey flap. C. With an Eslander flap. D. With a Karapanzik flap. E. Primary closure can be done. Question 18. Which of the following is an important contraindication for performing a submental flap? Size of the defect should be less than 5 cm in largest diameter. There should be a good arc of rotation from the donor side to the defect. The venous drainage of the flap should be into the internal jugular system. Presence of clinico-radiologically positive nodes at level 1A. Which is an important contraindication. Question 19. Free flap reconstruction for head and neck surgery is contraindicated in A. Diabetes mellitus, B. Sickle cell disease, C. Systemic lupus erythematosus, D. Peripheral vascular disease. Question is free flap contraindicated in. So we are at the last question, number 20. The purpose of a guide bite or a guide plane prosthesis for mandibular rehabilitation is to A. Improve mouth opening. B. Bear implants for dentition. C. Prevent deviation of the remnant mandible after flap reconstruction and improve occlusion. D. Improve speech. So the question is purpose of a guide bite prosthesis for mandibular rehabilitation. That was the last question. So do we give them 1 more minute to map up? Right. Do we have one more question? Yes.
We have got 3 compulsory questions.
Yes, sir. So this is, would you practice oral screening and tobacco counseling in your routine after this workshop? So there are your options, yes, no. I want to start ICanCaRe Tobacco Wellness and Oral Screening Center, or I want to get trained in tobacco intervention. Compulsory 2. TwistCare, the innovative mouth opening device for Christmas care made of POM material which is unbreakable. This sturdy mouth opening can measure the grading and improvement of mouth opening. You would like to order the same for your patient. So you can select whichever the options are there. Contact me to order. available in hospital pharmacy. They will ask a patient to purchase it online. But no, I prefer the old age methodology. I don't think anybody would take that option after this course. Compulsory question 3 is certified tobacco cessation specialist course is the only comprehensive tobacco course offered at that university. I want to take the course and I want to refer my friend for the course. You could have another option here, sir, that both of us want to come to the course. Right. So we will be posting the answers soon. So I think it is time to submit the. What do you want to give them? 1 more minute, sir?
Yeah. Just 1 more minute.
Yes, sir.
And I would request those who are just completing, let them go to this HTTPS Facebook page and join the I've just shared the link in the chat box. Please go to the page and community page so that you are connected with us.
Yes, sir.
During the program or later on also.
Yeah.
And of course, there is something very special for everyone, those who are participating for the quiz. We are giving them a special discount on this quiz care, right? So, which is being used. So, there is a claim a discount by applying discount code 25, and we'll be providing them with the emailers very soon. So, you can claim just by being part of this quiz, you are still getting a prize. And of course, those who get good marks and they have submitted early, they will get what we call scholarships for the certified tobacco cessation specialist course, and of course for others and some gift hampers as well. So I'm sure every one of you have enjoyed this. So